Back now at 8:19 this morning on Today's Health. Coping with allergies. Experts say this allergy season is worse than last year, and higher pollen counts and an exceptionally warm winter may be to blame. We've got Dr. Neilmed, Oz, host of the Dr. Oz Show. He's here with some medication-free cures. Dr. Oz, good morning to you.
Good morning.
Is it me, or are we just continually having worse allergy seasons?
Oh, they're definitely worse. Some of it's the urban sprawl. It's not just the weather, but this year in particular we had the weather. The key thing for folks to understand, if we're going to get you through your symptoms with no medications, you got to make the right diagnosis.
You want to make sure that you're not having a cold versus an allergy. How do you tell the difference?
Well, colds will come on slowly. Allergies hit you quickly. Colds will take about 2 weeks, but no longer to get better. Allergies, of course, will last all season. But you also got to contrast pollen, which, of course, is how trees and plants fertilize themselves, from mold. The pollen will be swept in hot winds. So if it's a windy day and you feel badly, you probably have a pollen allergy. Pollen will also get in your eyes. You get itchy eyes as well as the nose problems and the stuffy nose. But on the other hand, mold comes from spores in the ground, so moist days will give rise to that. So again, hot, windy day, it's probably pollen. If it's a moist day, it's probably mold. 10% of the population has mold. Don't confuse them.
Okay, so you want to help us, medication-free, treat some of these symptoms, including, for example, the one you just mentioned, the itchy, watery eyes. What can we do?
Well, of course, an ounce of prevention is worth a pound of cure. So preventing it with sunglasses is a very wise deal. But you want those big Hollywood glasses, just like that,
yeah.
Right? Donna, you look good with those.
Okay, I'll put them on right now.
So those big glasses will block off the pollen from getting into your eyes. So you look cool, but in addition, you won't have the pollen getting in there. Once it's in your eyes, you got to get it out. So you want to use a little bit of warm water with a tear-free shampoo. I showed an example here of one. And don't forget, the pollen sticks to your body. So you got to shower, especially if you got product in your hair. Shower that stuff up before you go to bed. Otherwise, you're going to be basting your eyes in it all night long.
Okay, now what about if you have an itchy, stuffy nose? Because that's also common with allergy.
Also common. Again, you can prevent that. A wide-brimmed hat will allow you to prevent the pollen from getting into your nose to begin with. You won't inhale it.
A hat?
A hat, but it's got to be a wide brim hat. It creates a little halo around you, so not all the wind that's coming past you gets into your face. And again, if you've got a lot of product in your hair, the pollen will stick to it. So the hat will prevent that from occurring as well. Once the pollen's in there, now you got to deal with the reality that you're already plugged up and you're sneezing and the like. Neti pot. I know it may not look great to use a neti pot, but a neti pot is a wonderful idea.
What is it?
It looks like a teapot, right? You put a little bit of warm water in there. It's got to be warm. If it's cold, you're going to think you're drowning in a pool.
Right.
So warm water with one packet of salt. They come sold together. Packet of salt in warm water in the neti pot, and then won't demonstrate it, but you put a little bit of water like this in your nose, turn over to the side. The water literally washes your sinuses out and washes out the nasal airways. That gets all that pollen or mold out of your nose, so you won't induce the allergy.
So some of us who've never done that before, we may be having all kinds of pollen and stuff up there that we need to get rid of.
Think about it. Do you brush your teeth?
Yes.
So why wouldn't you clean your nose out?
Good point. Okay. All right. Now, what about avoiding the symptom of itchy throat? Because that also happens.
It does. And this is a big, big piece of news. Please, everyone, sit down for a second and pay attention to this. There are a lot of folks who keep calling me and saying, I'm allergic to fruit, apples and pears and celery. I never had allergies.
For me, sometimes.
Mangoes. What's happening, actually, is you have allergies to pollen. And there's a cross-reaction between proteins found in the skin of these fruits and the pollen. So what you have to do is either peel the fruit or vegetable, which is incredibly effective. You won't have that feeling of itchiness in your mouth anymore when you eat these, or you have to bake it or microwave it just for a few seconds. But it actually denatures the protein so it doesn't cross-react. Your body's being fooled. It thinks you're having a pollen attack, but in reality, the protein in the skin of the fruit is causing the issue.
Dr. Neilmed, Oz, who knew? As usual, telling us something new. Thank you so much for being here. By the way, we want to mention that coming up on your show today, you're going to be revealing the $1 million winner of Transformation
So excited.
Nation.
I'm so excited.
It's palpable.